Good afternoon. Thank you very much. You may be seated. Thank you. Thank you. Before we begin, I do want to say a few words and a few words of thanks to our visitors here today. Uh, a lot of them are important. A lot of them have led the fight uh, in finding um, cures for HIV and AIDS, and I want to point out a couple individuals here today. Speaker Emeritus Nancy Pelosi, she has done a phenomenal job in seeing that the proper funding was there to continue research and to find a cure for this horrible, horrible disease. Also, want to thank Dr. Fauci. He's done a wonderful job. I did a wonderful job um, over at Bethesda. In the National Institutes of Health, did a great job over there for many, many years. Thank you very much for your support and guidance. It's good to have you guys here today with us. Survivors, advocates, faith leaders, scientists, nurses, community health workers, and Americans living openly and proudly with HIV, whose courage has saved more lives than any speech could ever do. To every one of you, thank you for never letting America forget. And thank you for never letting America give up. My fellow Americans, 37 years ago, the world set aside December 1st as World AIDS Day because the world finally admitted that silence was no longer an option. In 1988, grief was raw, fear was rampant, and far too many people were still being told explicitly or implicitly that their lives mattered less. On this day, every year since, we have chosen remembrance over forgetting, solidarity over stigma, and action over indifference. Today, we remember more than 40 million people worldwide who have died from AIDS-related illness. More than 700,000 of them are fellow Americans. We speak the names. We can speak, and we can carry quietly in our hearts the names that were never spoken aloud because shame or secrecy stole them away. We remember the artist who gave us beauty in the face of brutality, the activist who turned rage into righteousness demand, the parents who tucked children in for the last time, the lovers who held hands until the very end, and the countless everyday heroes who simply refused to look away. We remember, most of all, that every one of these lives was irreplaceable. And yet, on this same day, we also celebrate something that once seemed impossible. Progress that has been nothing short of miraculous. When my administration came into office in 2021, we did not treat ending the HIV epidemic as a slogan. We treated it as a promise. We relaunched the ending the HIV epidemic initiative with the clearest target imaginable: reduce new infections in the United States by 90% by 2030. 4 years later, I'm proud to announce that and report that the newest diagnoses have fallen to the lowest level since the CDC began keeping records in the 1980s. We are not just on track, we are on schedule. More Americans are on PrEP today than at any moment in our history. More Americans living with HIV are virally suppressed than ever before. More babies are being born HIV free, and because of the bipartisan leadership I mentioned in this room, that's here and across the country, we have invested billions of new dollars in community health centers, the Ryan White clinics, spring service programs, and mobile units that bring testing and treatment directly to the people who have been left behind for far too long. We modernized decades old laws that criminalized HIV in ways that were ignorant of science and indifferent to justice. We made undetectable equals, untransmittable, not just a public health message, but a legal reality in state after state. We have insisted out loud and without apology that fighting HIV means fighting racism, homophobia, transphobia, and the stigma that still surrounds substance abuse abroad. Through the President's Emergency Plan for AIDS Relief, PEPFAR, the program that President George W. Bush launched with moral clarity and that every president since has sustained with pride, my administration has now supported life-saving antiviral treatment for more than 20 million people in the hardest hit countries on earth. We have helped nearly 5.5 million babies be born HIV free who have otherwise faced the virus from their very first breath. And we have shown the world that American leadership is measured not only in the strength of our military or the size of our economy, but in the willingness to stand with the suffering when no one else will. None of this happened by accident. It happened because community organizers refused to be silenced. In the 1980s, it happened because scientists worked through nights and weekends. In the 1990s, it happened because a bipartisan coalition in Congress decided in 2003 that American values demanded we act globally. It happened because nurses and doctors and peer counselors never stopped showing up. And it's still happening because people living with HIV today continue to teach the rest of us what resilience really looks like. But let us be clear. Let us be clear-eyed. The job is not finished. There's still more than 1 million Americans that are living with HIV, and far too many of them still face barriers to the care that would let them live long, healthy, joyful lives. In some of our southern states, new infection rates remain stubbornly high. Black, Latino, gay, and bisexual men, transgender women of color, and young people in rural communities continue to bear a disproportionate burden. And around the world, 13 million people still become newly infected. Last year, 13 million tragedies we now possess. That was 13 million tragedies last year. You know, we now possess the tools to prevent. That is unacceptable, and that's why my administration will not rest in the coming year. We will launch the most ambitious expansion of long-acting prevention and treatment options in American history. We will double down on our investments in vaccine and cure because manageable is not good enough. When over is within reach, we still keep pushing states to eliminate every remaining HIV criminalization law that belongs in the last century, not this one. And we will continue. We will keep showing up for the most marginalized until that phrase left behind has no meaning in the context of HIV in the United States. To every young person watching today who may have grown up thinking HIV is ancient history, it's not. Get tested. Know your status. Talk openly with your parents. And if you're able, consider PrEP or the new long-acting options that can protect you without a daily pill. To every faith leader, preach love, not judgment. Your pulpits have power. To every employer and educator, make sure your health plans and your campuses treat HIV with the same urgency and compassion you would bring to any other chronic condition. To every American, wear red today. Light a candle tonight. Have the conversation you've been avoiding, because this fight is not someone else's. It's yours. It's all of ours. And to everyone living with HIV in this country and around the world, hear me clearly. You are not a burden. You are not a cautionary tale. You are not defined by a virus. You are beloved children, parents, partners, friends, and neighbors. Your lives are precious. Your contributions are profound. And as long as I'm president, you will have a fierce advocate here in the White House. And that government will not stop fighting for your dignity, your health, and your future. Getting to zero is no longer a dream. It's a plan. It's funded. It is underway. And because of the progress we have made together, because of the lives we have already saved and the stigma we've already shattered, I have never been more confident that we will finish what we have started. So on this World AIDS Day, let us mourn boldly, love fiercely, and work relentlessly until the red ribbon is retired. Not because we stopped caring, but because we finally won. May God bless all of those we've lost. May God bless those living with HIV today. May God bless the United States of America, and may He protect our troops. Thank you all very much. Thank you, thank you, thank you.